Hi, so in this video, I want to talk a little bit about what sex therapy is. Primarily, and of the first importance, is to say that sex therapy is therapy, and it's therapy in the context of how we understand counselling and psychotherapy. So it's a talking process based on the principles and the codes of ethics of professional bodies in counselling and psychotherapy. And in the UK, the professional body for sex therapists is the College of Sexual and Relationship Therapists, COSRT. And in our organisation, the Contemporary Institute of Clinical Sexology, CICS for short, we qualify people for registration with COSRT. So the first thing to be clear on is that sex therapy is therapy in the same context as counselling and psychotherapy, but the focus is on sexual problems. So we don't meet people who are having a wonderful time in their sex life. They don't tend to want to speak to a sex therapist. It's people who are having problems with their sex life that come to speak to a sex therapist. And they may be presenting to therapy individually with concerns about sexual function, like problems with erections, or problems with pain, or problems with interest or arousal in sex. And in our sex therapy trainings, we learn about how to think about sex in a way that can reduce the experience or eliminate the experience of functioning problems, so-called. We could also be working with themes where people feel shame around their sexual preferences. So they may have preferences that are perfectly consensual and pleasurable, but they may feel ashamed of them. Or our clients might feel that they're not in control of their sexual interests. They might feel that they have sexual compulsivity. So sexual function problems, problems with types and preferences of sex, issues of compulsivity, anything related to shame and trauma is the area of sex therapy, as opposed to the area of, say, general psychotherapy. I'm a UKCP registered general psychotherapist, as well as a COSRT registered sex therapist, and there is an overlap. General therapists and sex therapists will work with themes of sexual abuse, childhood sexual abuse, and potentially sexual offending. Domestic violence and sexual violence can be in that Venn diagram overlap between general therapy and sex therapy. The domain of sex therapists is about sexual function, erection problems, arousal problems, orgasm problems, and desire and interest problems, mismatched desire between partners, and so on. And at our school, the Contemporary Institute of Clinical Sexology, we, in our 2-year sex and relationship diploma program, we teach our students how to work with sexual themes with individual clients, and we also look at how to work with sexual themes and relationship themes with intimate partners and multiple partnered people. So, why would you choose to be a sex therapist? Well, you choose to be a sex therapist if you want to support people with resolving sexual problems, if you have an interest in supporting individuals with those specific themes. You would want to learn about sex therapy if you're working with couples and intimate partners, because it's connected. Sexual problems and relationship problems, sexual problems and relationship therapy are going to be connected. So taking a CICS certificate course, for example, if you're a qualified therapist working with couples, would give you that additional knowledge, as would taking the 2-year qualifying diploma. The thing to remember, though, is that it's a therapy approach. It's not, we're not sex coaches, we are not activists, although we have deeply embedded social justice values in all approaches to therapy. We're not sex educators, although sex education and psychoeducation is central to our work with therapists. And to be a good therapist, you need to have the personal qualities and the professional qualities to listen, support the person in front of you, have your attention fully on your clients. They're the primary focus, not ourselves, and listen to the nuance and complexity of their experience, and then bring into that the full range of different approaches, ways of thinking that we have to help a person or people in relationships resolve a sexual problem. And that's what all of the in-depth training that we do at CICS is about. So that's just a brief explanation of what sex therapy is and what it isn't. Primarily, if you're interested in this as a form of work, your main interest needs to be in being a therapist. Your secondary interest needs to be in being a sex and relationship therapist. If you've got your values that way round, this will be a joyous job for you. Okay, I hope that was interesting. If you have any questions, just drop us an email at CICS. The details are on the website. Thank you.